Hi, I'm Robin Raskin, and we're here at Digital Health Studio Live, and we've got a treat today. We like to think of WAINWRIGHT FISHBURN as our venture capital legend. If anybody has tried to be a VC, it is not as easy as it looks, and I think Wainwright's going to tell us some of what he's seeing, especially in the digital health industry, about what type of investments are being made and how they're working out and what we're looking at for the future. So I'm going to toss it right to you and give us like the bird's eye view from your perch about what we're seeing in the health of the VC industry right now.
Sure, absolutely. So I guess the most important thing would be to give a perspective of where I come from. So I'm one of the founding partners of the Cooley office in San Diego about 20 years ago. Cooley, as I think you know, is one of the legendary Silicon Valley law firms that has taken a Silicon Valley style of practice, or essentially representing the new economy with its roots in the Valley starting in 1925, over the last 20 years since we opened San Diego as our second office, to all of the technology centers across the country, and now internationally with offices in both London and Shanghai. So what that translates into is, with our roots as a law firm having formed or reformed more venture capital funds than any other firm in the country, we see the very origin of the companies across a whole spectrum of venture areas of focus. Today, Brian Roberts and I spent time looking at where we see the digital health sector as an investment opportunity, where it is today and where it's going. So that's really what it's all about.
So what are the characteristics of the VC world in the digital health area? Is it long-term investment, short-term, meant to go public? What are you seeing now?
Sure, yeah. Well, so I think if you look at the sector, if you go back probably about 10 years is where you first began to see the crossover between the classic life science industry and the digital industry. And I think if you begin to think very simplistically as the use of the smartphone as one of the tools that is enabling this digital health revolution, from a venture capital perspective, what we were looking at is there were a unique number of firms that were well situated with both a depth of understanding of the software as a service, digital tools, semiconductor chips as they play into cell phones and the like, with that set of disciplines crossing over to a depth of understanding of the healthcare industry. And so in the conversation today with Brian, Venrock is an iconic example of one of the firms that has been involved from the very beginning, back with Brian's investment in Athena Health in 1999. Fast forward to today, where the sector's touching just about every aspect of where digital health is meeting and improving our healthcare system.
Yeah, I love that checklist for aspects. So, what are the different aspects involved? Drop some names for me of other companies like Venrock that you've taken through this process.
Well, so Venrock is the example of our client, the venture capital fund, and there are countless numbers, but probably the more important point from our law firm's perspective is, while we do represent the venture capital funds, we most specifically represent the companies they invest in. And that's across the whole spectrum of areas where venture capital is invested. And Cooley has been the #1 firm over the last number of years in representing venture-backed companies that have gone public. So our capital markets aspect of our practice really is a reflection. The IPO is not the endpoint, but it's a very important crossroads that indicates that we've been involved with those companies since the very inception, and then taken them up through the crossover into the public market.
So with the digital health space, I know you work with health and wellness companies.
Right.
So an example of that.
Sure. So let's talk maybe a little bit specifically about digital health. So as many people know, digital health has received an enormous amount of venture investment over the last number of years, about $4 billion a year in each of 2014 and 15, and then the first quarter of 2016 is indicating in the same direction. So that velocity is had it really representing one of the major focal points of venture investment. And what the conversation today was all about was, is it a bubble, or are these companies really going to make a big impact in the healthcare system going forward?
So I got to ask you now, is it a bubble?
Yeah, I think not. I think what we talked about really is that there have been a number of companies that have been invested in, and so as in all cases, there will be winners and losers. But I think we are seeing that the healthcare sector is probably one of the last sectors that has not been enabled by new technologies and more integrated technologies. And so what we talked about is the various areas where digital health tools are impacting. At the simplest, the areas of health and wellness, simple fitness trackers like Fitbit, Misfit wearables. Misfit was a good example in that they sold recently to Fossil watches,
Correct.
and so it was an example of a classic consumer-facing company becoming now tech and digital health enabled.
Right.
We talk about impact on the tools of digital health moving into the flow of healthcare services. Airstrip, a company backed by Sequoia, is a good example of a company that has really worked to enable tools of integration in the clinical setting and the post-discharge setting. We're impacting the areas of insurance and giving the consumer more visibility into what insurance products are available, the best way to spend their healthcare dollar, and what physicians are most accessible for their particular need. And then we talked about telemedicine, where you can be in Rome or you can be in Beijing and you can encounter a problem and you can be on your cell phone and have a doctor visit.
Yeah, it sounds as if one of the things that you're doing is looking towards the future, seeing where the gaps are and who can fill them. So it's been great talking to you. I hope you'll continue to watch us. I'm Robin Raskin, live from Digital Health Summer Summit.